Hi, my name is Lona Muthamia Ochido, and I'm making it one of my life's mission to demystify the speech therapy field and to empower more parents on what they can start to do in order to optimize their child's communication outcomes. So whether you want your child to talk more or talk better, learn better, and overall optimize their potential. So stay tuned and feel free to send in any topics on speech and language development you'd like for me to tackle. Hi, and welcome to my channel. My name is Lona Muthamia Ochido, and today's topic that I'm tackling is how to treat stuttering in children. So if you haven't subscribed, please do so, and don't forget to hit the notification bell so that you get notified each time we publish a new video, which is mostly twice a week. So today's topic is something that I get a lot of parents ask me when they bring their children who are stuttering or stammering. By the way, stuttering and stammering really refer to the same thing. So I guess let me start off by just gauging what people know about stuttering therapy. So let me know in the comments below how stuttering is treated. Is it medication? Is it therapy? Yes, we know it's therapy. Could be medication, but what kind of therapy do you do on a child that stutters? So let me know, please. I'm curious to learn what everybody thinks about it. All right, so today's topic, how do you treat stuttering in children? I get asked this a lot, and I find parents, don't immediately know what that involves. So for therapy for children, I'm referring to 5 years and below, or, really for maybe not more than 5 years since the stutter began, because sometimes you can start a stutter at age 8. So at age 8, I don't consider a child that started stuttering at age 8, came for intervention 2 months later, in the same light as a child that started stuttering, say, when they started talking at 3 years and came for intervention at 8 years. So that child has been stuttering for a very long time. So there are different techniques really during therapy, but what is overarching all the treatment approaches is that if a child is younger or has not had the experience, I call it experience or habit of stuttering, so they've not really been stuttering for a very long time, then a behavioral approach to remediating the stutter is what therapists rely on. So at my clinic, I love the Lidcombe program. So the Lidcombe, I'll try and see if I can, I'll spell it so that you can read up on it. So that's Lidcombe, so the Lidcombe program. The Lidcombe program is one such behavioral modification approach to stuttering remediation that was developed by clinicians in I believe Sydney, so Sydney, Australia. I happen to have been trained in the Lidcombe program. So the Lidcombe program is a behavioral approach. So what this means, it uses the same principles of changing behavior it uses the same principles of remediating the stutter as you would to change any other behavior. So the assumption here is that the stutter is, like a habit, as I said before, and that the child can be shaped out of not stuttering. Yeah, the Lidcombe program has two phases. It has the treatment phase, which is phase 1, and then the maintenance phase. So the treatment phase is the aim of the treatment phase is to get a child to be stutter-free often, and the aim of the maintenance phase is to just maintain the stutter-free moments longer. So it's quite an elaborate treatment program, but I find it really effective because it shapes a new behavior. I tell parents that children who stutter, or anybody really who stutters, tends to mostly hear negative remarks about their stutter or about their talking. Rarely would a person encounter somebody else who stutters and says to them, "Oh, I love how you explained that point. I think the thing that becomes very glaring is the stutter, you know, the disfluency. So as a result, people who stutter, children who stutter, are always just getting negative feedback about how they talk, which in a way sometimes shapes the way they speak, or it shapes their stutter. Can you imagine if somebody is always correcting you, criticizing you for something, you tend to somehow do more of the thing that is being criticized. So it's the same with children. So when you shape you can, with the Lidcombe program, you are applying what's referred to as verbal contingencies. So you're applying feedback to when they stutter and when they don't stutter. And usually the ratio that's recommended by the Lidcombe program is 5:1, meaning when a child stutters, don't really offer any feedback. The only feedback, you know, that you offer is when they don't stutter, which is, that was very smooth talking. So make sure that you keep the ratio 5:1. Sometimes I'll say to parents, keep it 10:1. So you praise more than you give negative feedback, you know. So the child might be stuttering a lot, but you just pick for moments that are stutter free. Don't lie, you know, don't be generous. If they're not stutter-free moments, please don't say that was smooth talking. Yeah, so you can give them feedback. Oh, that was good talking. Oh, I understood that story so clearly. Oh, well done, you're such a good talker. Give them positive feedback. And then the one time that, you know, after you've given all the positive feedback, then you can alert them. Oh, that was a bit bumpy. Can we try and fix that? Can we say it again? And you can offer them, you know, you can repeat whatever it is that was stuttered, and then they will probably have a much better chance of actually saying it smooth. So that way, this child starts to get positive feedback for how they talk. And, you know, just like magic, honestly, it happens just like magic. You find that this child starts to, you know, self-monitor themselves better. They start seeing themselves as not just as a person who stutters or a child who stutters, but they also start to view themselves as a child who actually is able to smooth talk. You know, they're able to talk smoothly. They're able to talk, you know, without stutters. And that, I feel, is so important, particularly because, you know, children who stutter, and I do have a video on, you know, what stuttering is. I should have actually started by saying that, but I'm sure it's going to be linked here. Children who stutter and adults who stutter seem to also have, you know, be lacking in confidence. This is not the child that's going to put up their hand in class and say, you know, I didn't understand that, you know, and it could be because of the stutter, or, you know, or the feedback that is given to them. But usually little children haven't yet, you know, had this the stutter impact on their confidence, and really we don't want it to. That is why this therapy is done early on, and that is why Lidcombe program is so effective for children below the age of 6. So I think I have talked more than I wanted to talk about it, but yeah, so check out the Lidcombe program online. I should have a write-up on the Lidcombe program on my blog as well. But yes, so a behavioral approach is usually what is preferred for young children who stutter, because it has a very good chance of helping them manage their stutter. So we don't talk about curing, we talk about managing their stutter. I hope that this video has shed some light into what we do, the magic we offer children who have, you know, present with various communication disorders. Really, it's no magic. So that's the behavioral approach to stuttering. Thank you so much, and do check out our other series. You can check out what stuttering is. You can check out any of the other series that we have in this channel that may touch on, or that this particular video has brought up for you. If you haven't subscribed, please do. If you like the video, give us a thumbs up. Let me know in the comments. And yeah, really appreciate it. Thank you so much.